All of us have been affected by a medical crisis in one way or another, but despite this fact, not many people understand how the healthcare system works. From insurance companies to rural hospital emergency rooms, who or what really determines your standards of care, treatment plan, and road to recovery? The answer to this question is a complicated one and one that may also surprise you. Unfortunately, the healthcare system in the United States is by and large a for-profit system, with some nonprofit hospitals sprinkled throughout the country. Being profit-driven, healthcare has turned into a business. The problem with this is that some of the people given the task of choosing whether or not your treatment will be covered by your insurance falls to businessmen rather than those who are medically trained. Let's take a look at a typical visit to an emergency room to get a better insight as to what goes on behind the other side of the curtain. First of all, when we have to visit an emergency room, most of us are under heavy stress, anxiety, and fear, which clouds our judgment from thinking about proper questions to ask or ways to go about it. A study done by the Washington Post showed that the top 10 common reasons for an emergency room visit are sprains and strains, open wounds of extremities, normal pregnancy or delivery, headaches, back problems, upper respiratory infections, kidney stones, urinary tract infections, intestinal infections, or other minor injuries. The costs of all of these visits ranged from bills of $3.50 to $73,000, and I have a graph going around that shows the costs. But why was there such a variance? While some of the variance falls into hospital billing code differences, the direct effect on what you pay will be how much your insurance decides to cover. This is where we see health insurance having the biggest effect on healthcare, even more than physicians. So let's take a look at what the physicians do. Many of us just think of doctors as a small number of really smart individuals who went through a lot of schooling and come out making a generous salary. But to really understand the foundation of healthcare, we need to dissect what the word doctor. According to the dictionary, the root of the word doctor is Latin meaning to teach. In the book, The DO's Osteopathic Medicine in America by Norman Gevitz, doctors were some of the first public servants. They used to make house calls, and the welfare of their patients was clearly what they were dedicated to. After all, they do have to take the Hippocratic Oath upon receiving their medical degree, which in summary is an oath to do no harm. The meaning to teach refers to their obligation to not only teach the future generation of doctors, but to also teach their patients how to be well and lead healthy lives. This is the role of what we call primary care doctors, which are your family practice physicians and your pediatricians. This ties back into the healthcare system because some, especially those lacking insurance, do not see primary care physicians, which causes them to go to emergency rooms for common medical issues that could have been handled in a doctor's office. Emergency room treatment is much different than being treated in a doctor's office. After all, emergency rooms handle emergency situations that can be life or death, so insurance or money may not be the main priority upon arrival. This is why when you get the bill a couple of weeks later, your jaw drops when you see the amount. Being treated in a doctor's office takes a different approach. Many health issues can actually be handled in a doctor's office, and most people are unaware of this. According to an article from Fierce Healthcare, up to 70% of ER visits could have been handled on an outpatient basis. These primary care offices can offer treatment that is covered by your insurance because they are able to do what is called pre-certification. This is when they get approval by the insurance company that it will be covered before the procedure is performed. They can also look at your explanation of benefits, as can you, to see what your copays are, medications that will be covered, and tests that will be covered by your plan. For these reasons, seeking care at a doctor's office should be considered first unless the situation is truly emergent. So how does one get insurance or coverage? As most of us are aware, employers can offer medical insurance as employee benefits. The different plans are chosen by the company and are determined by cost to the employer and applicability to the employees. Plans like this are great because the employer pays a percentage of the premium and it decreases the cost out of your pocket. An article from Medical News Today describes the other two options for medical coverage. For those that are low income or needing government assistance, they are able to apply for Medicaid. Medicaid is coverage provided by the government and is funded by tax dollars. Coverage varies by state, but they are required to cover your typical medical needs such as vaccinations, prenatal care, inpatient or outpatient hospital visits, etc. The next program is Medicaid, or Medicare. Medicare covers certain disabled individuals and the elderly Americans 65 or older. It consists of 4 main parts, 2 of which deal with hospital and medical insurance, while the other 2 handle flexibility and prescriptions. A small monthly premium is collected for this program, but it also receives tax dollars. So as you can see, the common denominator in this equation is the insurance company or policy. When we seek medical care, we lay our fate in the hands of the physician, so we think. In reality, it is not only the physician, but also the limitations set by our insurance and money. But what can we really do about it? Education is the key. We need to be aware of our rights as patients, our insurance coverage, and how to navigate the healthcare system. In addition to education, healthcare reform is in current news, and we have the right to participate in lobbying, political rallies, or simply voting for politicians of whom we align with on this confusing and sometimes intimidating topic of healthcare.